Welcome back.
Good afternoon, everyone. We'll be starting with the second session now by Dr. Stefano Benedicenti on the topic lasers in dentistry. The moderators for the second session are Dr. Rajesh Pillai and Dr. Ambali R. Dr. Rajesh Pillai completed his MDS from the College of Dental Sciences, Manipal in 1997. He then completed his diploma in laser dentistry from the University of Geneva in the year 2013. He is currently the professor and HOD of the Department of Conservative Dentistry and Endodontics, PMS College of Dental Science, and is also the Director of Postgraduate Studies, PMS College of Dental Science and Research. Dr. Ambali R. completed her BDS, MDS, and PhD from Government Dental College, Trivandrum. She is a Fellow of the Royal College of Surgeons and Physicians, Glasgow, UK. She is currently working as a Research Director and Professor in Department of Periodontics, PMS College of Dental Science and Research. I now invite Dr. Rajesh Pillai and Dr. Ambali R. to welcome the speaker and to moderate the session.
It gives me immense pleasure to invite the speaker of my day, who is my teacher also, Professor Stefano Benedicenti. So welcome to our webinar series, sir.
Thank you.
Professor Stefano Benedicenti is the Associate Professor in Restorative Dentistry and Endodontics at the University of Genova, Italy. He is the Dean of the Laser Department Center of the University of Genova. Additionally, he is the President of the European Master Course in Laser Dentistry. He is a founding member of International Academy of High Technology. Professor Benedicenti is an author and co-author of 80 publications in national and international journals and has authored 3 books in the field of laser dentistry. He has also been an international speaker for implantology, ultrasonic surgery, cosmetic dentistry, intraoral application of hyaluronic acid and dermal fillers, and neurotoxins for aesthetic rehabilitation of patients. He is also the co-inventor of the IntraLift, that is ultrasonic minimal invasive crystal sinus lift technology, and also numerous surgical instruments. And he is also the visiting professor of various universities in Bangkok, University of Dalian, China, Chapel Hill, United States of America, and University of Leuven, Belgium. And he is also the international speaker for implantology, ultrasonic surgery, cosmetic dentistry. Sir, I welcome you for the lecture.
Thank you very much. It's a great pleasure and an honor to be with you, Dr. Pillai. I see many great friends like Dr. Singh. I had the privilege to spend some days in Dubai with him, and he also came to Genova. Hello, Dr. Singh. Always nice to see you. How are you? And for me, it's a great pleasure, and I will try to share my screen. It's my great pleasure to spend some time with you speaking about lasers in dentistry, which is a very interesting topic in my humble opinion. Basically, I come from Genova. Genova is a nice city in the northwest of Italy, close to the borders of France. And Dr. Taha and Dr. Singh, they have been many times to Genova, so they know that our city is not very big, but it has a very nice weather. Not too hot in summer, not too cold in winter. Our university was founded by Pope Sisto IV in the 16th century, so it's a very historic university. You can see here the president's office that was built in 1640. As I told you, University of Genova is an average university with 40,000 students, more or less 3,000 professors, but more important, we strongly believe on collaborations and alliances, international collaborations and alliances, and this is why 10% of our students, they are coming from abroad, and they are studying in Genova. This is my personal email address if you have any question. Our Facebook page, University of Genova Centro Laser. And I came to PMS College in 2013, and we started the first batch of the diploma in laser dentistry in 2014. I was younger, and I always am very happy, was very happy to come to Trivandrum. Nice hospitality, excellent food, great friends like the chairman, Dr. Taha, or Dr. Singh, or Dr. Pillai. So it's always a nice experience to be in Trivandrum. In terms of laser education, we provide introductory courses with our university. We provide many courses like fellowship courses we did in India before. And we have an international academic master degree in laser dentistry. This is a graduation ceremony with Dr. Parker, that used to be my coordinator, Dr. Alex Matthews from India, and our students, international students from coming from 18 foreign countries that are sharing their knowledge with us. It's a unique opportunity to share experiences from all over the world. So I wish you could come to Genova and visit our university, because we are very proud of our university. Going back to the topic of my presentation, I will speak about laser. Laser light is an acronym that stands for light amplification by stimulated emission of radiation. What does it mean? In a few words, we have a huge amount of energy, a very high energy, very well concentrated in a small area. Laser radiation is different compared to conventional light, because we have some main features of the laser radiation related to monochromaticity, collimation, and coherence of the laser light. But in few words, I don't want to go in details of laser physics because we have limited time. Huge amount of energy in a very small area, very well concentrated. Another important issue is that the majority of the laser wavelengths that we are using in dentistry are non-visible. So, and we need to be very careful, because we don't see this big power, this big energy, but it works. So we need to protect our eyes with glasses, with specific protective glasses, in order to preserve our eyes. So majority of radiations used in dentistry are non-visible. And this is a very complicated curve, but it's crucial for understanding when colleagues are asking, which laser do I have to buy? Which wavelengths do I have to use? And the answer is, it depends on what you want to do, because we have different coefficients of absorption. Related to different coefficients of absorption related to different wavelengths. So basically, if I want to have an ideal interaction with hemoglobin, for example, I need to use a diode laser. If I want to have a perfect interaction with water and hydroxyapatite, I need to use either an erbium chromium or an erbium YAG laser. So which wavelengths do I need? And the answer is, it depends on what I want to do. If I want to cut soft tissue with limited bleeding, I need to use a diode, for instance. While if I want to work on enamel, dentin, or bone, I need an erbium, because a diode laser has no affinity for bone, enamel, and dentin. So I can burn a tooth and spend hours trying to ablate a single micron of two structure, but with no results. So which laser do I need? It depends on what I want to do in my daily practice. From a theoretical point of view, we can sum up the effects of laser light in terms of ability to cut either soft or hard tissues. Hard tissues only for the erbium family lasers. We can decontaminate, we can biomodulate and provide an analgesic effect. And of course, we can use our lasers for bleaching. In terms of cutting efficiency, I just want to show you this publication that we did many years ago. Every statement you are hearing from me is supported by articles, by literature. I am academic, I come from a public university, so when I speak about food, I tell my personal opinions. I love Indian food, example. Not too spicy, but I love Indian food. When I speak about science, every statement you will hear from me is supported by publications, peer-reviewed international publication. This is an article we wrote many years ago with Francesca Angero, my pathologist, George Romanos, a colleague that is now working in New York, and with Rolando Crippa, the inventor of the technique. The article is based on the selective absorption of hemoglobin by the diode irradiation. So the idea was, do we have to cut this hemangioma, or can we use our laser radiation in order to induce a selective absorption of the radiation and have a coagulation of the blood inside this lesion without cutting it? And the answer is yes, we can have this coagulation, very quick coagulation with no bleeding, with no side effects, using a diode laser. And this is something I think very peculiar, and it's something that we cannot achieve with other techniques, with the surgical techniques. When I have to do this kind of surgery, I can use my scalpel, but for sure, I will have severe bleeding due to the high content of hemoglobin in this lesion. For sure, I have to suture this area, and I can have scars in a very critical area, visible area. With our laser, we can coagulate the blood, hemoglobin, in the lesion in few seconds without any contraindication, and this is the result. Let me show this quick video to show the technique to you. This is an example of an hemangioma, which is a vascular lesion. In this case, we have to use a diode laser, either 810 or 980 nanometers. This is the lesion. The power is high power. We need to coagulate the blood inside this lesion. And you see how easily we can coagulate, finished. We can coagulate our hemoglobin content in this hemangioma. So compared to conventional techniques, this is a very simple procedure, and in few seconds we can solve the problem. This is just an example on the possible applications of laser radiation in dentistry, and in my opinion, this is the ideal technique to avoid severe bleeding and possible complications with this kind of surgery. You can see that at the control, after 14 days, we will have a perfect healing. Here is the result of our surgery. Can I call it surgery? It's the result of our therapy, and in few seconds you will see the control after a couple of weeks. So the patient doesn't have to take any medication, and this is the control after 2 weeks. The lesion has been completely resolved with no post-operative symptoms, swelling, pain. Very, very simple and safe technique. Another publication, is it possible to do biopsies with our lasers? Of course, it is possible. Again, another article published in 2012 on laser and medical science, one of our most important journals in the field of laser dentistry. When we have this kind of lesions, these benign lesions like big fibromas, we can excise them with our laser. It's very simple, very quick. Do we need anesthesia? Of course, the problem of anesthesia is very subjective. I mean, some patients are feeling pain even with the simplest treatment, while other patients are tolerating pain. I suggest to use a little bit of anesthesia without adrenaline to prevent the any pain, and then we can do our simple excision with proper parameters. We have the second intention healing, and this is the fibroma that can be sent to the pathologist for examination, and this is the healing, perfect healing after a couple of weeks. Also, other applications of laser energy are related to prosto. We know what is an ideal impression. Now we have also digital impressions, but of course, when we are in front area, in frontal area, sometimes we need to use some conditioning techniques like retraction cords or electrosurgery. And laser, diode laser, can be ideal also in this regard to create a little bit of space to do the so-called gingival truffling, to create a little bit of space for the impression material. And the advantages of this technique are related to the significant pathogen reduction, to a perfect hemostatic effect, and we can speed up the healing of our soft tissue with the biomodulating effect. Some cases, I will not go in details of the technique with parameters, because this is a 1-hour presentation just to give you an overview of the technique. In Italy, we love metal-free crowns, but sometimes prosthodontists are not so accurate as in this case, with a very bad and poor marginal fitting of the two crowns. Okay, so we did a WhatsApp, we removed the pre-existing crowns, and this is the kind of preparation that we found. So my prosthodontist, Dr. Luca Solimei, he re-prepared these two crowns, and he used this laser just to create a little bit of space for the impression material. This is a very simple impression, and these are the two crowns immediately after cementation. I like the aesthetic, I like the color of these two crowns, but more important, I like the pink aesthetic. If we deal with our soft tissue in the proper way, and diode laser is ideal to do this slight gingivectomies and gingival trifling, we will have a perfect healing. Another simple case, this patient, she had a wedding in 1 month, and you know, in Italy, pictures are more important than the wedding itself. So this patient came to our university asking for laminates. You know, the ideal treatment, and I'm speaking, I see Dr. Singh, who is a great orthodontist. So I know that the ideal treatment would be ortho treatment, but we had only 1 month before the wedding. So we took an impression, we did a WhatsApp, we did a mock-up, and then we realized this surgical stent in order to do a laser gingivectomy, and in this case also a frenectomy, just to have the ideal parables for the preparation of the laminates. Okay, so slight gingivectomy without violating the biological width of these teeth. Immediately after the gingivectomy, we prepared 6 laminates, and after 7 days, this is our patient with temporary laminates. Okay, this is the final impression, and the cementation immediately after cementation. So 15 days, I told you that in 1 month, this patient had a wedding, and this is after 25 days. And I can appreciate the white aesthetic of these laminates, but more important, I like the pink aesthetic. If we use the laser in a proper way, we will always have a perfect and quick healing of soft tissue. Okay, this is again after 20-25 days with the laminates in place. Other cases, I go very quickly. Of course, we can use our erbium laser to clean these surfaces and to prepare small cavities. Again, we prepare laminates and laminates immediately after cementation. Okay, so lasers are for me, of course, in my opinion, lasers can really bring a big advantage in our daily practice. And one of the biggest benefits they can bring is related to the decontamination, to the significant pathogen reduction that we can have either in perio and in endo. And again, the biomodulative and analgesic effect. In endo, we all know that endo is the branch of dental science related to the study, form, and function of the health and diseased dental pulp. And according to Herbert Schilder, my mentor in endo, the 2 phases of the endo treatment are related to a preparation of an endodontic space with a proper shaping of the root canal, and more important, a good cleaning of the endodontic space. And then we have a 3-dimensional obturation of the endodontic space. And of course, endodontics, now thanks to magnification, ultrasonic devices, new night eye instruments, and laser, is more predictable in results, but but the real problem of endodontic treatment is always related to the infection, to the removal of the infection due to many reasons. And of course, when we have a vital tooth, the success rate in literature is very high. When we have infections, the success rate is dramatically decreasing. And the reason for these difficulties is related to the complex anatomy of the endodontic space, the type of bacterial colonization, and the poor ability of irrigants to reach the three-dimensional system. Complex anatomy, you see, we don't have only a main root canal, but we have apical deltas, lateral canals, and it's not easy to have access to this very complicated endodontic system. And you can see also in these beautiful pictures by S that the three-dimensional anatomy of the endodontic space is very complex. Another problem is related to bacteria. Even if the bacteria species in the endodontic space are usually limited to a small number of species, some of these are highly pathogenic. And we know that bacteria can colonize dentinal tubules up to 1 millimeter from the canal lumen. And we know that with the correct mechanical shaping, we can reduce our bacterial load by only 70%. And we also know from Elio Berutti, a great Italian endodontist, that the chemical disinfection can penetrate with sodium and hypochlorite, can penetrate only up to 0.1, 0.2 millimeters in the dentinal tubules close to the canal lumen, while the bacteria penetration, you see this beautiful picture of Andreas Moritz with the main root canal here and dentinal tubules filled with bacteria here, with cocci, a huge number of Enterococcus fecalis colonies up to 1 millimeter. So our chemical disinfection can help us to reduce the bacterial load, but the penetration is only 0.1, 0.2 millimeters, while bacteria, they can colonize up to 1 millimeter. So lasers can help us in improving the decontamination efficacy of irrigants, and the wavelengths we can use are basically ND-YAG, diode 810, diode 980, and now erbium-YAG. And we know from literature that these lasers, these wavelengths, are effective in penetrating deep layers of dentin. And according to Andreas Moritz in his nice publication, ND-YAG can penetrate up to 1 millimeter in dentinal tubules. So ND-YAG is an excellent wavelength to decontaminate our root canals. Diode lasers, they have also a very nice penetration, up to 0.7, 0.8 millimeters, and they can effectively decontaminate the root canal systems, while erbium laser has a limited penetration, but we have today a new technique for erbium laser that is very effective. In 2008, 8, with my group, Professor Casanelli is a microbiologist, Antonio Signore is our professor in restorative dentistry, Professor Ravera is professor in statistics, and myself, we published this article that was followed by many other articles on the decontamination of root canals with diode lasers. And we demonstrated that the association between laser irradiation and sodium hypochlorite can lead to a, and this is the protocol using our fiber, can lead to a 99.99% of bacterial reduction in terms of logarithmic scale. So we can effectively decontaminate our root canal systems with our diode lasers, and we achieve 99.99% of decontamination. And the results were statistically significant versus any single decontamination treatment modality. So if I use sodium hypochlorite, excellent. If I use laser, excellent. But if I combine the use of good irrigants with laser decontamination, I achieve better results, and these results are statistically significant. So the technique is very simple. I shape my canal in the conventional way with rotary instruments or manual instrumentation. When I come to the cleaning of the root canal space, I insert my fiber always in a root canal full with irrigants, full with sodium hypochlorite, 5.25%. Then the fiber is non-initiated. Then I retract my fiber from 1 millimeter from the working lens up to the pulp chamber. And you can see in this picture is the aiming beam, but you can see how the light is scattering everywhere and decontaminating the apical delta and the apical third of the root canal in a very effective way. A very quick video to show the technique. The fiber is inserted at 1 millimeter from the working lens and then retracted for approximately 5 seconds. And you can see how sodium hypochlorite is working and producing these bubbles that are effectively decontaminating the root canal system. Some example, in the past, when we had these apical lesions, we used to do our treatment in many sessions, but now we have our laser, either Nd:YAG or diode, to help us in decontaminating, or also the erbium laser that is very effective in decontaminating. And so we can shape the root canal, we can clean the root canal with our irrigants and our laser, and do the obturation of the three-dimensional space in the first session, because we are sure that we have a proper decontamination. So this is immediately after. I don't know why. Okay, and this is the control after 10 months. If we decontaminate, if we properly decontaminate the endodontic space, we will have a perfect healing of the inflammation around the apical area. So we have to decontaminate the apical third, and we will, in one session, if we have time, we do the three-dimensional obturation of the endodontic space, and we have the perfect healing. Another case, this is a very old case. I like to show this case because it was my mistake 20 years ago. This lateral incisor, I did it during a course, and unfortunately, this lateral incisor had 2 root canals. While doing the backpacking of the tooth, so I shaped the 2 root canals. I decontaminated with my irrigants and my laser the 2 root canals. I did the 3-dimensional obturation with hot gutta percha while doing the downpacking of the middle and coronal third using, I broke this gutta condenser, an instrument that was used many years ago to do the downpacking of the gutta percha. But basically, I did a perfect, a good and acceptable 3-dimensional obturation of the 2 canals. So healing is was an eventful and perfect. So I'm not suggesting to break instruments in the root canal, but this is just to show you that if we achieve a proper decontamination, we can have a perfect healing. I don't have much time to speak about periodontal disease, but for sure, diode lasers can help us in closed flap periodontal therapy with a bactericidal effect, with a biomodulative effect, and with a reduction of healing time. Both erbium, Nd:YAG, and neodymium, they have the ability to decontaminate the periodontal area, and this is the nice review published by Don Colusi. But in 2 ways, we can use our lasers at high power settings with a primary interaction of the laser radiation with bacteria, or we can use the newborn photodynamic therapy, which is an indirect interaction between a chromophore, a color like methylene blue or toluene chlorine, or indocyanine green, with at very low power settings, and it's a non-surgical photonic energy. It's an indirect interaction through chemical mediators with no risk or limited risk of collateral damage, and it's very effective. So basically, either photoablative therapy or photodynamic therapy with methylene blue or indocyanine green. Methylene blue is working properly with red radiation, 670 nanometer radiation, while indocyanine green is working perfectly with 810 nanometer diode laser. The interaction between the radiation and the 2 products is leading to a production of reactive oxygen species that has a decontaminating effect on periodontal bacteria. You see cases of closed flap periodontal therapy with either photoablative and photodynamic therapy. We always start with closed flap therapy, and then if we need to open a flap, we can always refer the patient to the periodontologist, okay? But closed flap periodontal therapy with our laser radiation is very simple, very predictable in results, so why not? Some examples from our dental hygiene school. We have a very nice dental hygiene, we are very proud of our dental hygiene school. And you see some cases of closed flap periodontal therapy with conventional therapy, scaling, root planing, and laser decontamination protocol. Also in other cases, unfortunately, in our academic master degree, it takes 1 week to speak about perimplantitis, and here I have 5 minutes, but also for the treatment of perimplantitis, laser can be a precious aid. In a case like this, we have a perimplantitis on the SIP implant with a suppuration with pus. Dr. Frosecchi decided to have a regenerative approach, so he raised the flap, he used this erbium to decontaminate bone, he used this diode to decontaminate soft tissues and the implant surface, and then he decided to do a regenerative procedure with a bone substitute and a membrane. Biomodulation, and I will speak in a minute about biomodulation. And this is after 1 week, and this is after 3 months, and you can see preoperative immediately post-op, control after 4 months, and final after a couple of years. Also, closed flap decontamination for implants is possible with laser technology. And our approach is always a closed flap approach as first approach. Then we decide whether to proceed with an open flap approach, debridement or not. One quick suggestion: don't use anti-yagon implants because they produce this melting of the implant surface with formation of titanium oxides. So don't use anti-yag for implants, okay? Last topic, again, it's not easy to speak about biomodulation in few minutes, but biomodulation is based on an energetic boost that we can give to the cell thanks to physical energy provided by a laser that is converted in a chemical energy in the cell. So physical energy photons are converted in the mitochondria of the cell in ATP. So with our laser, diode laser above all, with a flat top end piece and specific settings, we can give a boost to our cell and speed up the healing of our cell. As I told you, it's not easy to speak about photobiomodulation in 5 minutes, as this man here dedicated 50 years of his life to researches in the field of biomodulation. He recently published this atlas of laser therapy, and by chance is my father. So I'm happy to say that I was born with bread and laser and biomodulation in our university is a very crucial and important topic, okay? Not only used to treat aphthous lesions and herpes, but also to speed up the healing example of bone. And if you type on PubMed low-level laser therapy and bone, you will find 130 recent articles explaining that laser technology has been used to improve the clinical results of bone surgeries and of bone regeneration, also in implantology. In a case like this, when we have a fracture, a vertical fracture of our tooth, we can remove the tooth, place an implant, and speed up the healing of this implant with our biomodulation, with our diode laser. By providing a certain amount of energy every other day with a specific handpiece and have positive results. This is the impression, the temporary crown, the definitive zirconia abutment, and the final result, which is a good result with a perfect healing thanks to an accurate biomodulation. So the last question, I would like to leave you with this last question. Do I need a laser? I leave the answer to you. I hope that even with my quick presentation, I just asked questions and showed clinical cases just for you to consider if you need the laser or not in your daily practice. And I think I'm perfectly on time, maybe 5 minutes early, so I'm here for questions if you have any questions.
Thank you, Dr. Stefano, for the excellent presentation, clearly providing an overview of different clinical applications of lasers in dentistry in an evidence-based manner. And that too, not only in surgical procedures, but also for bleaching, endodontic treatment, impression taking, etc. I think participants got a clear idea regarding advantages of laser, especially for biostimulation and decontamination. Now the forum is open for discussion. All the participants can put their queries in the chat box. So I have a query. You have shown one hemangioma case. So what were the settings of laser used for the procedure? Was it used in a non-contact mode?
Yes. Very good question. Yes, it was used in a non-contact mode as we wanted the laser radiation to flow and to avoid cutting the epithelial layer and be absorbed by the hemoglobin content in the lesion. So very good question. Yes, it was used in a non-contact mode.
So what were the settings about the power, the time?
Okay, I didn't speak about settings because it's a very technical issue, but settings can change, can raise from 2.5 watts in continuous wave with a 810 nanometer diode laser up to 3 watts, 3.5 watts.
Oh, it depends on the type of lesion. It varies from patient to patient, right?
Exactly.
Okay, so and you have said that lasers can be used for biopsy as well. So how will you compare the quality of the histopathological picture when we use laser compared to the normal surgical methods?
Okay, we need to, of course, every new technology requires a learning curve. So in order to use a laser, you need a specific training, because at the beginning you think you are using a sword or you are using a scalpel. While with the laser we are using a light, a laser light, a special light, but we don't have to press, we don't have to use the fiber as we use a scalpel. So we need to learn the technique, and of course, we need to consider that with the laser we have a very thin layer, 30, 40 microns of carbonization. So we need to do our biopsy on healthy tissue in order to give to the pathologist an example of healthy tissue to compare to our lesion. So it's I mean, it's a technique that should be learned by the dentist, but in our courses we explain the technique. But of course, doing a biopsy with a laser is slightly different than doing it with a scalpel.
Okay. Thank you for clearing our doubts. Now you have put a question whether we need laser or not. Definitely, after hearing the presentation, we now know that it's an inevitable tool in our armamentarium. We definitely need lasers. I think Dr. Rajesh Pillai can provide more insight into the endodontic part of the lecture. Sir, any more questions?
No, ma'am. I think the speaker has addressed all the major aspects, I think, related to the general use of lasers in various fields of dentistry.
Okay.
And then, of course, if the students have questions, Dr. Pillai, you know everything about lasers, so you can. You are more expert than me.
Hi Sarah, du, das ist alles schon passiert, weil das ja 3,5 Stunden sind ja in der Zeit voraus. Und ich habe dich gar nicht erkannt auf dem Bild. So viel Haare. Wahnsinn. Klingt aber cool.
Sorry, maybe it's some.
Thank you. Now we have come to the end of the question and answer session. I invite our chairman, Dr. P.S. Taha, to express our token of gratitude to Dr. Stefano Benedicenti.
Thank you, Professor, for the wonderful lecture. After seeing you after a very, very long time, I really miss you. Hope everything is fine in Genova. Okay, and it was wonderful, very nice lecture. And according to me, dentist without a minimum diode laser is a handicapped dentist. Okay, so means minimum requirement is a 840 nanometer diode laser is a must for any practitioner. Okay, so anyway, thank you very much for joining us and giving your words of wisdom. Really thankful to you. Thank you so much.
Thank you.
Dr. Manjit Singh is here. Dr.
Thank you,
Singh is
sir.
here. Dr. Singh will say a few words.
I'd like to speak to you, sir. Dr. Stefano, I thank you so very much for it. The lecture was so enticing that I'm sure everybody will go and throw the razor and get onto the laser. We are so proud hearing it from the king of lasers. Thank you so very much, and I'm sure next year we will see you in person here.
For sure, for sure. Promise.
I am in Bahrain. I wish I was perfectly fine. Thank you.
Sir, Dr. Simon is also there in the audience, sir. His lecture will be coming up tomorrow morning.
Oh, yeah, Simon.
Dr. Simon.
Hi. Okay, I will be meeting him tomorrow. I will speak to him tomorrow. Yeah, thank you.
Thank you very much. Have a nice day.
Thank you. Thank you. Thank you.
Thank you, sir. With this, we have come to the end of the sessions for the first day of the International Faculty Week. I thank our chairman, Dr. P.S. Taha, for giving us this opportunity and for the constant support to make such programs possible even in these difficult times. I also extend my gratitude to all the speakers, moderators, and attendees for their participation. We will be continuing the rest of the sessions tomorrow. For tomorrow, we have 3 sessions in store, starting with the session by Dr. Kabilan Vilyagauntar on iron deficiency anemia and early childhood caries, followed by Dr. Anil Adarshna's session on vertical, skeletal, and dental problems in orthodontics, and the last session for the day by Dr. Fabio Savastano on neuromuscular orthodontics. Tomorrow's first session will commence at 8:30 a.m. I request all the participants to please assemble in the auditorium 10 minutes before the starting of the session. Wish you all a good day and thank you.